Uh-oh.
All right, Jackie, thank you so much. Now to antibody testing. It's a hot topic right now, especially since the Blood Connection's offering it to people as they donate their blood. Our 7 News medical expert, Dr. Cedrek McFadden, is joining us to talk a little bit about how this works, the antibody COVID-19 test. What exactly is that?
So when your body is exposed to a virus that causes an infection, the body responds by creating or developing these antibodies. These are just proteins that hang out in the plasma that then attach to the virus and cause it to basically become deactivated, prohibiting it from, coupling itself and infecting other parts of your body. The antibody test, also called the serologic test, works in a way by checking to see whether or not you have these antibodies in your blood. All right. It doesn't tell you if you have immunity, but it does check to see where these antibodies are present in the blood. And most of these tests simply just tell you whether you've been exposed to or not, as opposed to saying how much of those antibodies you have in the blood.
Yeah, I was going to ask, does it tell you how much of an antibody situation you've developed? Can you tell how long you've had the antibodies?
It doesn't give you that. It generally takes about 7 to 14 days to develop these antibodies.
Okay.
And that can depend on the time since exposure as well as your own immune system. So what that means is the lack of these antibodies doesn't mean you haven't been exposed to it. It may mean perhaps it hasn't been enough time to develop its presence in your body.
How accurate are these tests?
Big question, big question.
Yeah.
And that's the big concern also, because we like reliable tests. There are over 120 of these tests, and the FDA has released the marketing authorization that's normally required for some of these testing. There are 3 of those tests that have actually submitted for extra FDA approval. But what we find is that most of them are not terribly reliable, which means we really shouldn't be making plans based on the results. So just having a positive test doesn't mean you can go out and then kind of give up on all restrictions that you may have had before.
And what about immunity? Does it mean if you have the antibody test come back that yes, you have the antibodies, are you immune?
We don't know that.
Yeah.
And the test doesn't test for immunity. There's no test that we have yet that can say whether or not you are immune. But like most viruses, we suspect that there's some immunity conferred by having an infection. We don't know how much protection that is yet. It's just too early to tell.
So who should get this test?
So if you have certainly symptoms of COVID-19, this is not the test for you. You need a regular diagnostic nasal swab test. But for people that were suspicious may have had it, or if I recovered from my symptoms, it may have some interest for that. But the bottom line is, what do you change about that? If it doesn't change what you're doing with the results, you have to question why get it. What we are seeing is that the CDC and several agencies are using this material to gather data, because that's important to develop policy, which then may help us determine what resources are needed in certain communities that may have had high exposure risk. So as a community, it may be helpful to have some of this data to help us determine where we need to have centers of testing, or for certainly parents that are concerned about their children, have they been exposed that may put them at risk for other types of infections.
And also, like the blood donation situation, you might be someone that could donate plasma. So
Absolutely.
It makes sense there, because you may be able to help somebody.
Correct. But just having the test to say, well, I want to know whether or not I had it, I'm not certain there's a lot of use for that, because again, what's going to change? What are you going to do differently with that information?
Because you can't then act normal. You still have to stay within the protocols.
You still have to, because we don't know how long this immunity is for and how strong that immunity is lasting.
Dr. Cedrek McFadden, he's joining us to answer your questions live at 5. So if you want to go on the 7 News Facebook page, we're about to go live in the commercial break, and we will let you ask your questions for Live at 5, get some answers from Dr. C. Thank you. You're watching Carolina's Family at 4. We're coming right back.